This is the 7th annual LOC in the Lakes conference held by the Cumbria Learning and Improvement Collaborative. The theme today is inequalities. Cumbria has a lot of inequalities. There's a lot of marginalised people, there's a lot of deprivation, particularly on the small rural towns, and there's a lot of hidden inequalities as well. People assume that the rural areas are quite affluent, and actually that's not always the case. There's a lot of individuals who are really disadvantaged. So it's about raising awareness around inequalities, and more so thinking about what can we really do differently to make a difference around population health. We've got a lot of people, we've over 130 people coming today. I'm really excited. It's the first time we've been together in a conference because of COVID. So we've got people coming from across the North East and North Cumbria, from a range of organisations, from health, from care, the third sector. So we're really excited that people are coming to be here today with us to learn much more about inequalities. We're really delighted that Sam Allen, who is the new Chief Exec Designate for the North East and North Cumbria soon-to-be Integrated Care Board. She'll be joining us today to find about the work that's happening in Cumbria and to welcome everyone to the event.
I'm just looking forward to meeting people. I'm looking forward to hearing about all the amazing work that the Learning Collaborative has been undertaken over the past couple of years. And I tell you what, it's absolutely amazing to be in Cumbria. What a beautiful, beautiful part of the north. So ICB stands for Integrated Care Board, and Integrated Care Boards are coming into being really on the 1st of July. So we're taking over some of what our clinical commissioning groups have been doing, and we're really lucky to have the staff from the clinical commissioning groups transferring over. But essentially we'll be responsible for the planning and delivery of health and healthcare services across the North East and North Cumbria. So the big topic today here at LOC is health inequalities, really thinking about how we can work together to improve the population of the health, which will be a really significant priority for the Integrated Care Board. In terms of being a patient, a citizen and a resident, the changes shouldn't be significant. You know, things won't be changing on day one. We've got a National Health Service that's been here since 1948. Our role is to provide healthcare free at the point of delivery. In time though, one of the things we really are going to be focusing on is how we improve people's health outcomes. So particularly through the lens of access and people's experience, which is why I'm so excited about being here today, because we're only going to be able to do that if we really work together with our communities and also work together with all parts of our communities. So I hope in time people will feel like they're more engaged in their health and their healthcare, and that we're also able to demonstrate improvements in the population health and health outcomes.
So today the LOC in the Lakes conference is exploring the issue of health inequalities and what we can be doing as a system to tackle it. So I was delighted to be part of the conversation involving Sir Michael Marmot, talking about what's causing health inequalities across the country, across the county, and to start to explore the themes that we can follow to try to tackle some of that, and in particular the importance of the social and economic determinants of health and well-being, and the role that the NHS can play in delivering services that are equitable and using its massive purchasing power and the fact that it's a great standing employer to do some of that work on itself. I think there's three things that I would want people to take away today. I would like them to take away the importance of tackling health inequalities. The pandemic has seen health inequalities grow across the country, and we need to do something about that. I would like them to take away a sense that we can do something about it. We've seen the evidence that we know what can work. It's a big job, but we know what can work to improve health inequalities. And thirdly, I'd like them to take away the sense that we can really work together on this. This is not something that any one organisation can solve. Everybody has to work collectively against that common goal, because we know from the pandemic that we can be fantastic if we work together with a common goal and sufficient urgency.
This is an absolutely really, really dynamic, interesting and collaborative approach. I'm just so impressed by it all and really pleased to be here.
So we're at the first break after an absolutely fascinating morning. We've just had one workshop, but the two keynote speakers, Dr. Colin Cox and Michael Marmot this morning, the statistics and the information that they've given were just absolutely fascinating.
I've just done the first session with Every Life Matters, and it was really useful to kind of hear from people in the room how we can work differently to engage our children and young people, both in the design of services but also really in the co-production, and engage them in how services are delivered going forwards.
It's been fantastic to be here and get together with so many colleagues across North Cumbria. It's been a long time. It's been great to hear about all the statistics, the information that tells us about how our communities are doing, you know, in terms of population health. I've found it interesting so far. I'm keen to learn lots more this afternoon.
Actually seeing people face to face today has really inspired us all, I think, again to get back and put extra effort into the great work that we're doing here in North Cumbria. I've been to an amazing workshop this morning around autism done by AAA, and really inspired now to use the learning from that in developing our health checks for people with autism in GP practices.
I think the opportunity to see so many people from different organisations, and obviously this is organised and run by CLIC, which is a fantastic organisation on behalf of us as a partnership here in North Cumbria, and they're here and be inspired by the many speakers, all of which have many projects going on in relation to health inequalities. And it just proves to me that the best way that we can deal with this is in partnership, and also as well trying to look at ways of preventing ill health in the first place before we actually end up potentially people ending up in hospital or with more serious conditions.
Well, I'm here for two reasons really. I'm the president of the Royal Town Planning Institute, and my themes this year are health and wellbeing, climate change and what the government calls levelling up, but we would talk about tackling inequalities. But actually I'm also here as the co-lead for the Healthy Happy Places programme, which is part of the Academic Health Science Network in the North East and North Cumbria and the Integrated Care System. We're talking specifically about how our programme can make a difference to the health outcomes at a population scale in the areas that we're choosing as pilots, and the real difference we're trying to make in terms of community engagement and also co-production, because we fundamentally believe that this will be the way that will change the approach that we have to making places, and also ensure that the places that people are in, the existing places that they're in, can be optimised to support their health and well-being, specifically through the lens of mental health and well-being, because we're really interested in that as a kind of starting point and a basis for lots of other good things that can happen, both in terms of health but also people's economic well-being too. The big takeaway is for everybody to think about how their practice and what they do actually works with the built environment, whether that's the room that they practice in, whether it's the community that they work in, or whether it's something about the need for their town to work better for their resident population, because actually we want a pipeline of projects. We want this to turn into an innovation hub that is a shining light across the UK, that is based in the North East and North Cumbria.
So I've been here representing Every Life Matters, who are a county-wide suicide prevention charity, and we were really honoured to be invited to come down and deliver a workshop about listening to the voice of children and young people to better access mental health services, and also really honoured to be given the opportunity to speak in front of the entire group as well about the work that we do across West Cumbria in terms of grassroots suicide prevention, and just really share that message of hope with everybody about positivity, and you know, there is support available, and that we can all make a difference in reducing the number of suicides across the area. I also kind of wanted to leave people with that afterthought of what can they do, what change can they actually implement within their own organisation, within their own community, even within their own families, you know, giving people that opportunity to think about, well, actually mental health needs to be something that we talk about every day, and thoughts of suicide, we need to erode the stigma surrounding that, because the more we get people to reach out and talk about it, the more likely we are to get them the help and support they need. And a little reminder about looking after your own mental health is never a bad thing at all.